Finding problems? That's easy. They exist in every community. I'm Terry Springs, your host. We're looking deeper, and we are talking solutions, finding out how we all can make a difference. This morning on Talking Solutions, we've got our friends from Positively Kids. First of all, Fred Schultz, who is the founder and CEO of Positively Kids. Also, we have Dr. Farroq Abdulla, who is a neo-natologist. Let's say it right.
You got it.
At Foundation for Positively Kids. If you've driven around, you've seen the donation boxes, and you've heard about different fundraisers for Positively Kids. It's been in Las Vegas for a very long time now, but maybe people don't know exactly what you do.
Oh, let's talk about that. Good to see you.
Nice to see you.
Yeah. I started the Foundation for Positively Kids 15 years ago, and that was for the purpose of caring for kids who are medically fragile. So kids who have long-term chronic illnesses of some kind, depends on the medical acuity, some are greater than others, to provide services for those kids. And we started off with a home health agency. So we still have a home health agency. Those are nurses who go out into the home and provide skilled nursing care upon physician's orders to care for that child and teach the mother how to provide medical services for that child. And then we've extended on to a number of other different services along the way. One thing kind of led to another. Families would call and say, boy, I'd like to get my little child into daycare, but we can't get into daycare because he's too medically complex. He's in a wheelchair. He's got a feeding tube. He's got a whole bunch of issues that are going on. And so we said, well, why don't we make arrangements to provide a nurse in the daycare? So we provide nurses in existing daycare facilities, and little Johnny can go to daycare, and we take him out of the wheelchair and we make him part of a whole inclusionary program. Nobody's done that before. You know, the daycares were afraid to let the kids come into daycare for liability issues.
Well, they've got their hands full to start with. And to take on that advanced level of intention, I mean, you want to talk about high needs kids.
Yeah.
As far as what is required to get them through the day.
You know, you've got a child with a feeding tube, you've got a child with an IV, you've got a child who's wheelchair bound, and so there's a lot of issues that need to be addressed. Mom needs to know that little Johnny is safe when he's in daycare. The daycare wants to know that there's somebody there medically to help out if there's a problem or an issue. And so we've got nurses on site to do that. And then it led to families saying, boy, we sure could use some skilled respite at home. Respite, of course, meaning the relief of the family. But the skilled piece is what's important. This is not just babysitting, but this is a nurse who comes into the home and takes care of the child while mom and or dad or a single parent goes out and does whatever they need to do. I'll give you some examples. We had a 3-year-old who was on a ventilator who had a gunshot wound. And so we've got a child who's 3 years old with a tracheotomy on a ventilator who's a quadriplegic that needs to be cared for. The siblings are in school. It's a single dad. Dad needs to go to work. And so we send a nurse to the home that took care of the little girl while she was, in this kind of a situation. Nobody else does that. Nobody else provides those services. And so that's been another important step along the way in providing an extensive total care coordination program to take care of the child who's in that kind of situation.
Well, I'm thinking about the story that you told us, Fred. This 3-year-old had suffered some kind of a gunshot wound.
Right.
We'll hear about that on the news. Sometimes the kids don't survive. But when they do, it's kind of top of mind. You hear about it on the news, and then it becomes yesterday's news, and it's farther and farther away,
Sure.
and you never really take any time to consider what happens to that little child.
Sure. How does it affect the rest of the whole family? I mean, and it's not just the patient alone, but what happens with the rest of the family, with mom or dad or single parent. And what about the siblings and the close relatives who are involved, maybe the grandparents or the aunts and uncles and those kinds of things. And then we've moved on to some other additional programs over the years, and that's the contract that we have with the county at the Child Haven campus. That's the campus for abused and neglected children. There's 3,600 kids in foster care, and we provide clinical services on that particular campus also. So we've got foster parents who bring in one of the kids that they're watching after, and we provide a regular well and sick clinic there. You don't necessarily have to be medically fragile for us to provide services, but we've got doctors on staff there and physician's assistants on staff there, and we have nurse practitioners on staff there. So we provide 24-hour nursing services on that campus at Child Haven, 7 days a week. 24 hours a day, plus we have the clinic 5 days a week there to give vaccines and treat sore throats and just the common things that you would take your own child to your own doctor to.
You guys do a lot more than I thought.
We got pretty busy pretty quick with a number of things going on, and the extension after that became the Clark County School District, who called us and said, would you be willing to run our school-based health centers? And there were 3 of them, and we said yes. And so we run 3 school-based health centers. So those are clinics on school campuses, Cunningham School, Martinez School, and the Elaine Wynn School. school where we have an actual clinic that sees kids either through appointment that come in or vaccines, or a child that gets hurt on the school playground. He falls down, hurts his knee. We take care of the child there.
Wow.
So it's a busy place.
I had no idea. I'm loving this.
Yeah, lots have happened since we've seen you a number of years ago, that's for sure.
Wow. It's exciting.
We continue to grow.
And you got something new. That's what we're going to talk about today.
New.
This is like a whole new level of service.
This is another level of service. As we look at total care coordination and encompassing that family and that child in total care of services, what we're looking at is providing a number of things for the family that they've maybe not been able to get those services in the past. And so we've brought on Dr. Farroq Abdulla, who's with us here today, who'll really fill us in on exactly what's going on. But he'll talk about some of those numbers. But those are infants that are born early. These are children that are born early. They don't go full term. And of course, if you're born early, there's a number of issues that take place. And we've got to have a specialist on board to do that. And that's why we've got Dr. Abdulla with us here today.
That's huge. Just before we started the show, I was saying that I actually have firsthand experience in my family about children who are born before they come to full term. I had my first great nephew. This happened actually in Nebraska, not here. My niece, Melanie, her life was in danger. And the doctors said, we've got to take your baby out now because you may not survive. And she was in imminent danger. So they delivered Logan at less than 2 pounds. And he went into an ICU unit. Unfortunately, as you mentioned, there are medical complications that come with a baby that is delivered so soon. It's wonderful that they are able to survive, but the medical costs are off the charts. To get Logan out of the hospital months down the road, we're talking about a total medical bill of about $2 million.
It's expensive stuff, that's for sure.
Yes.
There's no question about it.
How old is he now, you said?
7.
The smallest one I have said was less than a pound.
I don't think the time is that far removed where a baby who was only 1 pound just did not survive. That was not an option.
It's not too far, long, yeah.
And things continue, too, when you're born that young. The lungs were not fully developed when you're delivered that early, and so he's still on oxygen. He now has a service dog. I love that dog.
Yeah.
It's amazing. He's whip smart. Great kid.
You know, and there's a number of issues. Dr. A will talk about this, but it's also a business. The care of children is now also a business. It's just not the medical piece. It's the whole business of medicine now. Who reimburses? How long does the child stay in the hospital? Does the hospital want the child out sooner? There's a whole number of issues that come up and why we do the things that we do. You're talking about, 2,500 premature babies are born each year in this community. People don't know those numbers. Dr. A knows those numbers. Dr. A deals with that on a daily basis and the numbers of children. He's just going to be so busy when the clinic opens. The grand opening will be coming up on the 19th of February, which will get all that out to our listeners and our contacts to let them know. But that's basically what's going on with our new clinic.
This clinic is something special, and I want to make sure to introduce and thank you for coming to join us. Dr. Farroq Abdulla, you are on staff with the Foundation for Positively Kids. Tell us about this new neonatal clinic.
Thank you, Terry, for inviting me on this show. First of all, let me take you just a step back and give you a little bit of information about prematurity. Prematurity is the leading cause of death in the United States, and it represents more than $26 billion in healthcare costs every year. Now, if you just look in the United States, there are over 4 million births every year, and approximately 12% of those births are born prematurely. That means less than 37 weeks of gestation. This 12% amounts to about 500,000 of babies who are born prematurely, and all of those babies are admitted to the neonatal intensive care unit, and they add up to the costs of about $26 billion a year. That's a humongous cost.
It's very expensive.
More than 80% of these admissions, that makes about 400,000 babies, they are born between 32 and 37 weeks of gestation. And these are defined as late preterm infants. Outcome of these preterm infants born between 32 and 37 weeks of gestation indicate that they are at increased risk of developmental disability, school failure, behavior problems, cognitive impairments, social and medical disabilities, and even death. Most neonatal intensive care units, they do have a program to follow up those preterm infants, but they only follow the infants who are born before 32 weeks of gestation because they are considered at the greatest risk of post-discharge neurodevelopmental morbidity. But they do not offer services to the preterm infants who are born between 32 and 37 weeks of gestation. Our high-risk program, which we will be starting here with the Positively Kids, will help and facilitate safe and early discharge from the neonatal intensive care unit, and will offer services to all infants born prematurely, and will follow them up in the clinic as per guidelines from the American Academy of Pediatrics and the National Institute of Child and Human Development. Now, I want to bring a very important point here for you. This early discharge from the neonatal intensive care unit will have a great impact in two ways. Number one, this will help improve the quality of care by having the infant born with the family a few days earlier. And that will further help to improve the neurodevelopmental outcome of these preterm infants. And number two, again, very important, is that a few days of earlier discharge from the intensive care unit will help to save hundreds of millions of dollars in healthcare expenditure costs every year. The cost of these babies who are getting ready to go home is about $1,000 a day. And if you can discharge them 2 or 3 days earlier, and there are 500,000 babies born prematurely, you can save over $1 billion a year. And you may know that Medicaid, more than 50% of this $26 billion a year, which we are expending in these healthcare costs. So there's a big advantage of discharging them early and having a follow-up program like this, because as yet in the state of Nevada, we don't have a formal program which will follow these babies who are discharged from the intensive care unit.
You're creating something that did not exist before.
Correct.
It adds up fast, though, those costs for the babies that really just need that extra huge amount of care to get them out of the hospital. So if you can get them out a few days early.
Absolutely.
Through your careful supervision and also help to monitor after the fact and save all those dollars, because when you talk about Medicare expenses, who's paying all of that? Hello, us taxpayers.
That's right.
So even if you don't directly have a child in your household or in your direct family, you're still being impacted by the medical costs that Medicare ends up paying. As you say, Dr. Abdulla, more than 50% of those costs. So it helps all of us to have this here.
There's no question about it. And of course, we also have the contract with the state for kids who are developmentally delayed, and a lot of these kids are. And growth and development of these kids are really important. And so we're looking at a number of training programs. We're looking at educational sessions to work with the families, counseling for postpartum depression, how to detect and treat behavioral and anxiety disorders. I mean, there's a number of things, and Dr. A knows those much better than I do. But the contract that we have with the state for developmentally delayed kids is now providing physical therapy, occupational therapy, speech therapy, vision, nutrition. I mean, there's a whole host of things. We could go on and on about it. But because we've got that contract with the state, we're able to provide those additional services along the way.
And those services are very important for these preterm infants because they are developmentally delayed. So putting them into these early intervention services help them to achieve those potential earlier what we can do for them.
They're delivered at a not quite full-term age in many cases. Right. So they're dealing with, I know I mentioned my grandnephew, how he had lung issues and still does deal with those. And it is expensive, but we can lessen that with the right supervision and the right directions. In an infant who is delivered several weeks premature, I would imagine that part of the problem with the cognitive and the functioning is that the brain is not quite as, does this make sense? That the brain is not 100% developed yet. Even in normal full-term infants, they're still growing in those areas. But certainly in an infant that is delivered early, who has those issues, needs a little extra help in developing the mental capacity, the ability to function.
You're absolutely right. And you just mentioned about your own family, your child who is still requiring some oxygen. And actually, even full-term babies, their lungs are still not developed. It takes 2 to 3 years for the lungs to develop. So those babies are born prematurely. They can still continue to develop normal lungs, and eventually they can be off the oxygen. So the child in your family, maybe a few years later, he may be able to breathe on his own without any oxygen because the lung tissue continues to develop after even 3 years of age.
There's so many things with babies that happens even after birth, and we are always concerned. Very impressed, too, with the Foundation for Positively Kids. You talk about even the immunization clinic and services that you provide. Because we all know that young children, their immune systems are not fully developed to start with, even in the best of situations. So when we are in a flu season like right now, and when we are looking at vaccinating whomever we can and keeping everybody as safe as possible, these children, some of them are too young to get the immunizations. As adults, what I've seen is that we all need to make sure that we're healthy so that we're not spreading things onto these kids whose immune systems aren't fully developed. Kids, even in the best of situations, still are developing with those immune systems. So there's a lot of things that we really need to look out for little babes.
Yeah,
absolutely.
There's a ton of things. You know, in addition to adding this other piece of services, we also have a health coach And that's kind of a new concept, which a lot of people are not aware of. We have a health coach who is a nurse. That's part of all of our programs. So if you see a child for the first time, Dr. Abdulla might only have 15 or 20 minutes or 30 minutes the first time. Then he wants to do a follow-up, watch weight gain, watch development, and those kinds of things. But what happens between that first visit and that next visit? That's when the health coach comes into play. Dr. Abdulla might say, I want a health coach to go out to the home. So we send a nurse out, and the nurse starts to watch for some of these other things that Dr. Abdulla is concerned about. What else is going on at home? What about nutrition for mom? What about nutrition for the baby? What about weighing the baby? What about watching that weight gain? Those are things he's concerned about, failure to thrive, as we refer to it, and those sorts of things. He really doesn't want to wait, and our doctors in any of our disease processes really don't want to wait from the first visit until the next visit, 2 weeks from now, 3 weeks from now, 4 weeks from now, a month from now, whatever it might be. What's happened in between? If we're aware of what he's concerned about, we can report back to him so that the care becomes even better than it would be than just waiting for the next 30-day visit.
When you talk about a 30-day visit, that's a long period of time in this young child's life. So if you're totally blacked out as far as information about what's going on with that baby during that 30-day period in between medical visits,
Sure.
to give the proper instruction and guidance so that that parent knows, A, how to treat, B, what to look for, and C, what to do if things aren't going as well as we might have hoped.
You're absolutely right, and I agree with Fred on this one. That's the most important thing in the first few months of these premature infants is their nutrition and their growth. So we do need to monitor their nutrition and growth. The best food for these infants is the breast milk. Breastfeeding is considered as the best food for the baby. And even American Academy of Pediatrics has mentioned that infant nutrition should be a public health issue, and breast milk has huge benefits, immunological benefits as well as anti-inflammatory benefits, which protects the infants from infections and allergies down the road. So we will have a separate breastfeeding room for the moms as well, and we will have people who will be educating the moms how to promote breastfeeding. Say that I do not have much breast milk production, we will have lactation consultants available as well who will support the mom on these issues.
It's so important. There just is nothing better than the mother's milk.
One more benefit of breastfeeding which we kind of ignore is that it decreases the risk of obesity by 20 to 30%. And you may know that childhood obesity is like an epidemic in this country. Down the road, we will be developing a program for prevention of childhood obesity as well. So we will be working on these two programs. Gradually, we will progress to that and hopefully be able to reduce this obesity. Right now, Nevada is 16th from the top in childhood obesity. More than 32% of children between 10 and 17 years of age, they're either overweight or obese. So we need to fight that obesity as well.
And we know what that leads to. Childhood cases of type 2 diabetes.
That's right.
And all of the complications and all of the medical risks that are associated and the expense. You can just stack up all the problems that goes with that. So if you can come along with the Foundation for Positively Kids, Dr. Abdulla, and through all the services that are offered, where we start with the baby, watch and guide and make sure that the mom is breastfeeding and is comfortable with that and that we're all on the same page, we get this baby going with the best chance possible.
Absolutely.
Absolutely.
We're very excited about it.
Coming up this month is a big grand opening.
It'll be the grand opening on the 19th. And it's real easy to make an appointment. 262-0037 for our listeners, 262-0037. Follow the prompts and they'll get an appointment right in Dr. Abdulla's office. And it's going to get busy real quick.
Yeah,
There's no question about it. They finished up everything. So they're in there with all your supplies and ready to go. And I know Dr. A is ready to get in there and get started today for sure.
And there's a lot of needs. In our area, around Las Vegas, Clark County and such, was it 2,500?
Yeah, 25. In the whole state of Nevada, there are over 34,000 deliveries. And just the Las Vegas and Henderson area is over 20,000 deliveries a year. Out of that 12% preterm babies, that comes to about 2,500 preterm babies every year. When they're discharged from the NICU, we don't know where they go. So that is the reason it is very important that we have to follow these babies. We do have to have a data collection analysis to evaluate the long-term outcome and prognosis. For right now, we do not know how does that baby look at a year of age, at 2 years of age, 3 years of age. We have no data. So if we are able to collect this data and evaluate their prognosis at 2 or 3 years of age, we can find which baby was doing better. Then we can go back and see how we can change the management of these babies to improve the clinical outcomes.
Got to keep track of what's going on.
Absolutely.
And so the data collection, very, very important. Plus that's going to build the track record. That's where we're all going to say, look what this does. Look what the Foundation for Positively Kids, here's what they can do to help.
The high-risk infant program is really the first of its kind here that Dr. A has put together. And the early discharge from the hospital is certainly so important because we're back to the business of medicine again. It's not only the medical component, but it's the business piece, the insurance companies, the early discharging, the costs of keeping the child in the hospital. Those kinds of things are really important. And of course, with the early discharge, it allows more bonding time with the mom and the baby, which Dr. Abdulla is very concerned about also. The breastfeeding and the bonding and those kinds of things. Less time and expense in the hospital, and being discharged earlier is, again, the business of healthcare, which is important. We never had to be concerned that much about that in the past, but we need to be now. It's the new way that we must manage our children in the business of medicine.
On one end, you've got these very nervous new parents. We have to go.
We don't feel comfortable leaving yet,
We're scared.
But they'll start to feel comfortable now.
But it's not like they're just being dumped out of the hospital. They're not just being shooed out the door. Mm-hmm. You're not going alone. There's still a support system. We're going to make sure we keep track of you. We're going to teach you what you need to know.
Absolutely.
We're going to make sure that you're comfortable with the breastfeeding and the nutrition and the way to take care of that new baby.
Absolutely. We will have education classes for the mothers as well, how to learn the sign language of the infant, the cues. And one more thing, we will be having the mothers who have been in the methadone program. When the babies are born, they have withdrawal from methadone. Mm-hmm. So we will be following those infants in our clinic also, because right now what is happening is when those babies are delivered in the hospital, they continue to stay in the hospital for weeks and weeks, even months. What our program is going to do is we will try to get them discharged on methadone, and we will slowly wean them off of the medication. Because those babies whose moms have been on methadone during the pregnancy, they can have withdrawal symptoms for several weeks and even several months. And it is not good in the baby's interest to have that baby in the hospital. The best place for that infant is with the mom. And if the mom is on methadone, we encourage her to breastfeed as well. So she can go home, breastfeed on the methadone medication, and we can take care of that as an outpatient instead of the baby staying in the hospital for weeks and months.
Well, they're trying to heal the mom from the addiction by using the methadone, which through her system, the baby is born with an addiction to this methadone. Baby never knew anything about this.
Absolutely.
And so not only making sure that everything's good with mom, that she's bonding with the baby, she's spending time with the baby, but together with supervision, they are continually being weaned off so that they can be healed.
Absolutely.
Go forward.
And one more good thing is the Nevada State Medical Association, they have supported this program, and they say that they support legislation to assist the creation of the neonatal intensive care follow-up program. So hopefully we will come with the legislation which will mandate these kids to be followed up in the high-risk infant follow-up program.
You think that might happen? I know that the legislature up in Carson City is just getting started.
They got a lot of issues they got to deal with already, right? I don't know if we can add this one to it now, but it becomes a long-term legacy that we need to create also. So when none of us are here anymore, 50 years from now, that we've got some laws in place, some regulations in place, some statutes in place that will continue to care for these children. I'm glad that Dr. Abdulla brought up about the drug-addicted mom and infant at birth, because we just had one. When Dr. Abdulla came on board with us just about a month or so ago, we had a child that went into foster care. Nobody wanted to take this child. Nobody would care for this child because the child was drug addicted and the child was on methadone. And Dr. Abdulla was the only one who was able to care for that child and provide those services and convince the foster parents that it would be okay to take care of this child, and he would lead them through this safely for the baby.
Yeah.
You know, that's just one case that we're talking about.
Babies are at our mercy.
Hundreds, thousands of cases.
This clinic sounds just terrific, and all of the services that are provided for families and children from the Foundation for Positively Kids. I've known about you guys for a long time, but I did not realize the array of services and the tremendous variety that you actually are offering to kids and families here.
Yeah, we really do. And, you know, you can't just stay focused on one little thing, because it's a comprehensive care coordination program where all of the services must be provided. You just can't do some of it and not part of it any longer. So we're proud of it. We're excited about it, and we'll see folks out at our clinic very soon. It's on Tompkins Avenue off of Eastern and Tropicana.
If somebody is looking for information, your assistance,
they can get on our website and certainly find our number and information, a list of services there. The easiest way is just call the main office number, 702-262-0037, and they'll get connected to the clinic right away, and then Dr. Abdulla's staff will make an appointment for the client right away.
This is great. We're excited that you came to see us even before you did your grand opening.
Thank you.
We've had Fred Schultz, who is the founder and CEO of the Foundation for Positively Kids, and also Dr. Farroq Abdulla, the new clinic for the babies who are born prematurely, for babies who are born with issues, there's a lot of things that you're going to be able to deal with.
Absolutely. I always want to work as a team, as a partnership. So I remember a quote from Henry Ford: coming together is the beginning, keeping together is a process, and working together is success. So I hope we all work together and we will be a very successful team with the Positively Kids.
Working together is success. I agree with that. Thank you so much for joining us today on Talking Solutions.
Thank you, Terry.
Thank you.
Hope you can stick around. We've got part 2 of Talking Solutions coming up next with a couple of events happening next Saturday. One is the Healing Hearts 4K Run and Walk for the Rape Crisis Center. The other is a big get-together with Metro. Everybody is invited, and it's free. Hang tight.